Let me guess, that dry cough you have been having for weeks. You thought it was just air pollution or an acidity. You are not alone. I see this every week. But sometimes what seems to be ordinary could be more serious, a lung cancer. Let's talk about it clearly, calmly, and with hope. Hi, I am Dr. Jitesh, thoracic surgeon and oncologist, and today I'll walk you through the lung cancer surgery options, what they mean, and how we approach them. Lung cancer is the leading cause of cancer-related deaths among all male and as well as female worldwide. But also, it is most treatable cancer if treated early. So there are two main types of lung cancer. One, the non-small cell carcinoma, which accounts for 85% of the cases and usually grows so. The second one is the small cell carcinoma, which is more aggressive and it responds well to the chemotherapy. Now, the key to the survival is the early diagnosis and a personalized treatment. So who is at risk? Not just smokers. That's a myth. People think if I don't smoke, I may never get lung cancer. I'm safe. Yes, smoking is the number one cause of lung cancer, both active as well as passive. If you are in a surrounding where there are people who are smoking, you are at risk. But lung cancer can also be caused by various other factors. Long-term exposure to the surrounding air pollution, if there is an industrial pollution due to asbestos or radon, if there is a family history of lung cancer, then you are at risk. If there is a past history of lung infections like COPD, then you are at risk. If you have persistent symptoms, you should visit a doctor and get yourself screened for lung cancer. Symptoms never to ignore. Early lung cancer often does not cause any pain. So look out for if there is persistent cough, which is more than 2 to 3 weeks, if there is blood in your sputum, if there is breathlessness on exertion, if there is hoarseness of voice, if there is chest pain or unexplained weight loss or fatigue which is without intention. These symptoms may seem common, but they could be a red flag. Don't ignore them.